Good afternoon. I'm George Latimer, Westchester County Executive. I'm here with Deputy County Executive Ken Jenkins for our Westchester Weekly Update. It's 2 o'clock on Monday, and we want to convey to you some information about the extent of the COVID virus infections here in Westchester County. We'll be talking about a couple of other issues as well that we think are relevant, particularly what the statistics are on crime in Westchester County, that the crime statistics show that we are down over the last few years, and we'll cover that in some greater detail. We'll be joined in a few minutes by the Deputy Commissioner of the Department of Public Safety, Terrence Rayner. We'll also be talking about some job opportunities, a job fair that's coming up, and we have our Director of Economic Development, Bridget Gibbons, who will be joining us as well. But for our opening purposes, we generally do begin with the status of the COVID outbreak, and where we were a month ago and where we are today are a little bit different and not in a positive light. We have seen now an increase over the last 4 weeks, 5 weeks almost now, of the COVID virus infections, primarily attributed to the Delta variant, which has been in the public news. It is a different form of the disease. It has determined that it is far more communicable than the experiences that we've had dating back to the original introduction of COVID-19 in our society. And the greater communicability of it means that more people have caught the disease than we've had in recent memories. Just to give you a rough parameter, we'll look at the numbers of where we are as of yesterday. The tracker in New York State gives us up-to-date information through Sunday, August 1st. On Sunday, August 1st, we had 131,612 positive tests for COVID over the extent of the pandemic. If we go back 1 month to the day to Thursday, July 1st, we had 129,888 cases. So the difference shows you that there's about 2,000 cases that came in the month of July. And those cases, when you subtract out the folks that have gone through the 2-week protocol period, we currently have active cases, people that have not yet cleared the 2 weeks period, 1,225 active cases of coronavirus today. 1 month ago today, we had 196. So we've gone from 196 to 1,225. That's a significant multiple, probably in the vicinity of 6, 7 times the amount of infections. If there is any good news in all of this, it's that the hospitalization and the fatality numbers have not grown as exponentially. We had back on the first 6 people that were hospitalized for coronavirus. We currently have 28. But that 20 number has been fairly static now for about the last 4 weeks. We've been anywhere between 20 to 30, as high up as 30, as low down as 20. And that has been not following the same proportional increase in the amount of infections. And the fatality numbers have been encouragingly low. We lost 3 people in the month of July, 3 fatalities over the course of the full month. That is a very low number of fatalities compared to other months, even as the number of infections rose. I must always say, as I always do, every loss of life is a tragedy. It's a personal loss to the individual's families, the people that know that person and love them. But when we look at it from a broader standpoint, the number of fatalities has not followed the rate of infection. So what we're seeing is a reintroduction again of the virus in our world, but we make the presumption that the amount of vaccinations that are out there have helped us in reducing the severity of the illness as it affects a number of people. And we're very pleased to announce, this is the first day we can announce this, 80% of the population of Westchester County, adults 18 years of age and older, 80% of them have had at least now 1 vaccine dose to fight coronavirus. Hitting the 80% mark puts us in a small category of other areas. Nassau County hit the 80% mark. I think Manhattan County and New York County is also in that category, but most other places are below that number by some percentage. Now that is the 18-plus population. It does not include children under 18. And as you know, children under 12 are ineligible for the vaccination. So when you look at the society, the population as a whole, and you include young people, that population of at least 1 vaccine dose is 67% of our population. So that factors in what happens when you add the large cohort of young children who are ineligible for vaccination. And if you want to look at the number of people by absolute numbers that have completed the vaccination series, we're closing in on 600,000 Westchester residents who've completed, not just 1 dose, but completed the vaccination. And that's roughly about 62% of the population based on our 2010 census numbers. Now, within the month, we expect to get 2020 census numbers. We're hopeful that they'll show a significant increase in population, so that may adjust some of our percentage statistics. But the bottom line is that we have had a very good response for vaccination in general, with 80% of the population having some vaccination en route to full vaccination. And the vaccine has proven to help resist the Delta variant. But the Delta variant apparently is still very strong and has had their impact in a very significant way. When we look at where we are in comparison to where we were a month ago, it's clear that this is a steady rise, and we know that those numbers will continue to go up unless we take certain efforts and certain activities. So we're going to share what some of those activities are today. They are the first stage of a series of activities. We've been through this all already. We're not surprised. We had the original spike that came in April, March into April of 2020, and then later in November, as we started to approach the holiday season, the Thanksgiving and New Year's, Christmas holiday season, we saw a second spike. And in both of those cases, we got up to 12,000, 11,500 active cases. We're at 1,225 now. So that's a big jump up from 100, but it's still well below what 10, 11,000 active cases would be. We also saw that we had a great degree of fatality in the first two rounds, which was before we had a vaccination available to us. We now have vaccines available to us, which should help us in terms of dealing with keeping people healthy enough to not suffer death, which is, of course, the thing that is the most difficult thing for all of us to deal with. The vaccination numbers are encouraging, but when we deal with our workforce or we deal with other general assessments of the society, we must remember that it's the senior portion of our community that has the highest percentage of vaccinations. Seniors, clearly, and I'm one of them, we see ourselves as the most vulnerable to the disease, and so much more ready to vaccinate, and there we get up to the 80 percentile. When you take seniors out and looking at a workforce, which has very few people 65 and older that are still actively part of the workforce, that percentage number comes down. And it is in that area where people are out and still working, where they're interacting with other people with a highly contagious virus, that we now have to make some efforts to try to ensure public safety. We are not at the point where we are going back down in the rabbit hole. The fear that we're going to see big close downs of businesses and reducing the number of people that can go to work or can enjoy outdoor activities is not where we are today. So let's be clear. We have not reached a point of crisis that warrants those types of severe measures. That they are measures that occur only when the facts on the grounds justify it. And the fact on the ground would be when we did it in the past, we were dealing with a very high level of infection, much greater than what we're seeing now. On the other hand, the increase of infections does tell us that the sort of celebratory moment that we had in mid to late June is behind us. And so we are now reinstituting certain types of activities. Now, as county executive, I have limited executive authority, and that executive authority governs county-owned facilities and the county-owned world, if you will, activities and buildings and things of that nature. We do not, as a county government, I do not, as a county executive, have the ability to issue mandates that affect the totality of society. The governor holds those executive authorities, and as we watch his reports on a regular basis, he determines what he feels he can introduce and impose. What we do have control over is what we're going to talk about in this next component. We have reinstituted a mask requirement for every individual who's going to enter a county office building. We are not closing any of our county office facilities that are normally open to the public. There are some facilities that are not open to the public. You can't walk into the sewer treatment plant or walk into the material recovery facilities just to walk around and see what's going on. Those are normally closed to the public. But the ones that are normally open to the public, where we have offices where we're providing a service, whether it's the Department of Social Services or our Consumer Protection Office, whatever it is, you still will have access to the buildings, but you must wear a mask. It does not matter if you're vaccinated or unvaccinated. Ken and I up here, we've both been fully vaccinated. We've fully gone through our protocols, but now we wear the mask in the office when we're in contact with other people. The main public areas of the county office structures would be the main lobbies when you walk in, or the elevator lobbies on any floor above the main floor, in the elevator proper, We're reducing the maximum number of people in the elevators, and then, of course, they're worn when you're in an office dealing with any of the county employees. This is a very narrow area of mandate authority that I have, but it is that which we can do, and we need to do it. And we need to do it for those who are vaccinated and unvaccinated, because even if you've been vaccinated and you get the disease and it doesn't affect you because your antibodies created from the vaccine fight it off, you don't get sick, you feel healthy, you're asymptomatic, you still can transmit the virus to somebody else. As I understand it, I'm not a scientist nor a medical professional, the virus load, the amount of virus that will be in your system when you're exposed to and capture it is of such a magnitude that it's easy to transmit to someone else. And that's why the masks are on. Remember, we taught this right at the outset, the masks aren't on to protect us as much as they are to protect other people. So if I wear a mask and you wear a mask, you're protecting me, I'm protecting you. That's how we get the mutual protection factor. There is some benefit to wearing the mask to prevent you receiving some of the other things that are happening in the area. But for those people who don't like to wear a mask, I'm a member of that club. I do not like to wear a mask. This is now August. It is hot outside. It is uncomfortable even under normal circumstances, and even though we've dealt with this for the better part of a year, it is not normally a part of our culture to wear masks. When you get a heavy cold or you get some other type of thing, you stay home, you don't go out. But if you go out, it has not been part of our culture to wear a mask. So like you, I'm in the same boat. But like you, I understand that the health of the people around me are as important as my own personal health. So it's not just about what I want to do that's comfortable for me. I'm in a room right now with our Deputy Commissioner of Public Safety, the Director of our economic programs, my friend, the Deputy County Executive, Lisa Reyes is with us here, who is one of our key communications managers. It is my concern for their health that requires me to wear a mask when I'm not speaking. And the same applies to every other county employee. In the public face of the county, we are instituting, as of Friday, at two types of facilities that we have where people do come in close contact. Our beaches, of which there are three, Playland Beach, Croton Point Park Beach, and Glen Island Beach. We have Glen Island back for the last month. That you must wear a mask when you are entering the beach. When you go through the entry point in any one of those beaches, you must have a mask on, and you must keep that mask on until you go and set up your blanket and where you're going to sit for the day. Once you're sitting on your blanket with your family or your friends or your significant other, you can take your mask off and enjoy the day. But when you are getting up to walk through the crowd, to go to get a snack at the concession stand, to go to the restroom, to do anything of that nature, throw something in the garbage can, you must put the mask back on while you walk through the crowd. The one exception to that is when you go into the water or into the pool to enjoy swimming. And in those situations, you're not going to wear a mask while you're in the water, so you don't wear a mask. We'll whistle past the graveyard a little bit if in those situations as you walk to wherever the beach, the water line is on the beach that you're in. The same applies to our pools. Pools are a little bit different because pools are defined areas of which people can surround, in some cases, the totality of the pool. It doesn't work that way in every single setting. We have 4 public pools in Westchester County, Saxon Woods in White Plains, Wilson's Wood in Mount Vernon, and 2 in the city of Yonkers, Tibbetts Brook Pool and Spring Ridge Pool. Each of those pools are also open, and each of them will also have the same restriction: mask on when you go through. When you're on your blanket, okay. When you're in the water, okay, no mask. When you're moving about the pool or the beach setting, mask. And one of the things that makes beaches and pools different from other kinds of facilities is you tend to go there for the day. Once you plunk down, you're in some proximity to the same people all day, and that's a little bit different than when you're in an environment where you might be walking on a trail, you're walking through the trail, you might pass by somebody, but you're not with that person the totality of the day. There are no additional mask requirements for golf, for nature centers, for hiking trails. Our bicycle Sundays have not been asked to automatically put on masks. We may get to that point if we see this continue to spread, regardless of our good nature. We're also observing the circumstances at Playland. And Playland is the largest single place where people gather in a park setting. And of course, the concerns we have there are pretty obvious. But we did not have a mask requirement this weekend. We saw that quite a lot of patrons had masks on. Some did not. We're going to make sure that all employees have on masks, and they should have on masks to protect you from them, and out of courtesy, you should protect them from you by also wearing masks. And we'll talk a little bit more about what we'll do at Playland and any of our other facilities at this stage of the game. But those are the mask requirements. Those are not optional. Those are mandated. Those are expected by all county employees and all visitors to county facilities within the lines that I've just said to honor that mask commitment. Now, we've also had discussions about vaccinations, and you've heard some other elected officials, the governor of the state, the mayor of the city of New York, some of the mayors of Westchester municipalities establish a standard that they think works for them, which is to say that all workers are mandated to be vaccinated between now and Labor Day, and then if they don't get vaccinated, they'll have to be tested once a week. The spread of this virus may very well require all governments to establish a testing program in September, regardless of vaccination status or not. So if the punishment for failure to honor the mandate is testing, it's more likely than not that we're all going to have to be tested on some systematic basis. Now, it's a massive task to take, a significant percentage, 1,000 people or something of that nature of the Westchester workforce, and say we're going to test them every week. We need to be helping people to test all across the county, all across the society, not just within our workforce. So we're having discussions about what the testing component is going to look like, but as a punishment, if you will, for not vaccinating, we're not convinced that that isn't going to be an automatic, no matter what we do, that we're going to have to test. As far as the vaccination situation is concerned, and there's different schools of thought on this, and we're going to pursue a strategy which we hope will work, and if it doesn't work, we reserve the right to change that strategy. We're very practical-minded people. It's my reading of the situation, and we've talked to a variety of different people about this, that the act of saying that something is mandated and letting it stay out there as the only statement you make will not necessarily get the compliance you want. People who are unwilling to take the vaccine will not hear the order to do it as persuasive, intrinsically persuasive. And perhaps because I have a private sector background as a salesperson, marketing background, it is my belief, and I think our belief as an executive committee, that what needs to happen is we need to reach out to those people in our workforce that are not vaccinated and dialogue with them and speak persuasively to deal with their objections that they have, try to overcome those objections, and get voluntary compliance. And it's not voluntary compliance like we hope you'll do this. We intend in the next 2 weeks to survey all county employees, find out who's vaccinated, who's not. We understand some people may not want to tell us one way or the other that they're vaccinated. We will have to treat them as if they are unvaccinated for the sake of this discussion. And those folks that are vaccinated, they'll have to prove it. It's not a hard proof. I go into my wallet, and right there with my overdrawn credit cards would be a vaccination card that I can easily show. You may have on your phone the Excelsior Pass, which will also show that you're vaccinated. That verifies it, that you have gone through the vaccination protocol. For those who have not done that, we're not looking to create a Scarlet A for people, but what we do want to do is go department by department, have a team of us, myself as part of that team, to discuss those reasons why, to try to address them in an intelligent way, and to try to make a case that is persuasive. I believe we will get as much or more compliance with that strategy rather than a strategy that says, vaccinate or else. Now, depending on how widespread the pandemic becomes. We don't know how much of a crisis this is. Over the course of the next month, these numbers may quadruple. We may reinstitute at the county level, and we may reinstitute at the state level, maybe the national level, states of emergency, which could be redesignated by the executives in those situations. And we will have to see what happens on the ground based on the numbers. But we're not going to do it based on ideology. And in the same way that we kept certain things closed and we opened certain things, we made those decisions case by case by case. And I believe we can make a case for vaccination on the merits person by person by person. There will be some people who will not want to vaccinate. We knew that from the outset. We talked about what herd immunity would get us, and herd immunity at some percentage would help. But we also understood that we live in a country where people hold their personal rights very, very close to the heart. On the other hand, there's case law as well as practicality that says that my right to do whatever I want within my right as an American has some limit to it. And that limit is where my exercise of my free right bumps into your exercise of your free right for health and safety, or as they said in the Declaration of Independence, life, liberty, and the pursuit of happiness. Your life, liberty, and pursuit of happiness, not just my life, liberty, and pursuit of happiness. This is a great debatable topic. I think we debated in high school. I think we debated it in college, maybe in grad school. But here we are in the practical world trying to define where do my rights go, how far, and how far do your rights go. Right now, we're going to try to work with our workforce. We're going to try to make progress. We're going to try to get as many people vaccinated as we can. We're going to try to determine how we have to test people, and not just our workforce, but the population at large. It is true that those who are fully vaccinated can get the COVID virus under this Delta variant. It is also true that it is much less likely that that will happen. And it is also true that if you get it, you are far less likely to be sick enough to go to the hospital. You're far less likely to die from it. And you're far less likely to get the long hauler realities for which many people who have survived COVID still have issues, health issues that have arisen that now linger and are not going to be so easily handled in the months that are yet to come. It is true that there are questions about taking the vaccine or not, and there are some people who don't really have a question. They just decided for themselves they're not going to do it. It's where they're at in their life, where they're at in their head, what their ideology is. But we will try to honestly address those and deal with them, and to do it up close and personal, to try to show that our intent is to try to protect the health and safety of people, the health and safety of the workers of this county, and the health and the safety of the people who live in this county. Every effort we've made has been along those lines, not along ideological lines, and we'll see how that works as we go forward. We are certainly going to make it as easy as possible for people to get vaccinated. We have since the beginning of this in January. We have two health centers, health clinics, one here in White Plains that gave out the first in-site vaccination under our Westchester County auspices back in January. Here on Court Street in White Plains, we also have a health clinic in Yonkers at 20 South Broadway in downtown Yonkers, and those two locations are available for vaccination purposes. The Westchester County Center is still a vaccination site. Perhaps in one of my more recent reports, I talked about how those numbers had gone down. Well, the numbers are starting to inch back up again as people determine that they are going to make sure they're vaccinated. So the county center, which has really vaccinated over 400,000 individuals, or 400,000 vaccinations administered, or maybe 2 vaccinations, has really been an anchor in how Westchester has helped reach the 80% mark. But what we have done more recently, and I want to thank Emily Saltzman of our team for doing this. She's worked in concert with Chris Steers of our team, who's done this, and Aviva Meyer and a number of other people, certainly all throughout our health department, under the direction of Charlita Amler and Renee Recchia and so forth, is a series of satellite vaccination centers. They're called pop-ups. I don't quite know how that became the way to refer to them as. But the satellite locations, we've done them in schools. We intend to do more of them in schools. We had one this past weekend in Tuckahoe at the community center on Columbus Avenue. Ken was able to be there with Mayor O'Meara and Dino and members of the Tuckahoe Village Board to try to help people in that area. And we need to target those vaccination locations in a host of different areas. We certainly will be talking with the various hospitals in Westchester County, the 11 hospitals here, to determine what role they can play, neighborhood health centers, what role they can play. And of course, we've had many pharmacies that have provided vaccinations over the county. It's a multi-tiered level of vaccination, and we may have to go back to look at all of those again. And I would add one other factor, which is not yet on our agenda today, but that is the potential that the CDC, the federal government, ultimately down through the New York State Health Department, may in fact mandate that those who have been vaccinated twice are required to get a booster shot, a third shot. That is a very plausible potential in all of this. We are not at that point today, let's be clear, but let's also be clear that the county center is going to stay as a vaccination center, and we may very well yet find ourselves having to go back out and getting a third shot in order to be better protected against the Delta variant or some other variant that may be following Delta in a line. We really don't know, what we're into. I want to, particularly on the topic of workforce vaccinations, compliment the first department that we are aware of that has 100% of their employees vaccinated, our County Consumer Protection Office under the direction of Jim Masano. has 100% of their members all vaccinated. There are some other ones in county government. We'll announce them as we go along to show that it is possible. Obviously, smaller departments are more easily, the 100% mark is reached a little bit more easily, harder to do in the departments with larger populations. But we want to point that out with great pride, because we think that the act of inoculation against these diseases is not a political statement, it's not a demographic statement, it's a statement in which you understand what will protect your health best and the health of the people around you. And so our hats are off to Jim Maisano. As we start to roll out this campaign, just the facts, we're vaxxed, and make it very simple and very straightforward that the facts are clear, and that vaccination is the single biggest tool we have. But it's not the only tool, which is why we've reinstituted the mask requirements, as I've described, why we want to re-encourage social distancing. In some contexts, that's hard to do, but we need to go back to social distancing, making sure that people that we are not in normal close contact with, we have some distance between them, so it's less likely we can convey whatever between each other. The reinstitution of hand sanitizing as part of our normal life, and we're back to giving out PPE as well in outreach to chambers of commerces and local houses of worship and local community centers. All of those things we have to get back to deal with. We are a little over a month away from the resumption of schools. Schools may be in the week before Labor Day. This is a very late Labor Day, so there's almost a full week of September before we get to Labor Day. And some school districts will be back before Labor Day, some will be back right after Labor Day. This morning we had the first call with local school superintendents that we've had in about a month and a half. We suspended them in mid to late June as they got to the end of the school year. The county government does not have direct authority over school districts, but we are a helpful partner in implementing the decisions that are made by the state government, to whom the school districts directly report to the state education department. We want to be a good partner with them. We do provide the public health assistance through our county health department and through the vaccination efforts that we've just described. So we look forward to working with those school districts. As of this moment, we do not have new guidance yet from the state of New York on what they expect to see these school districts do. We are at a point where that is needed on a timely fashion, but that will come out of the state resources. But once those statements are out there, what do we do about social distancing in a school? What kind of requirements for plexiglass is available? How much can be remote learning and how much in-class? We all know that in-class learning is essential, but we're dealing, and certainly at the elementary school level, with an unvaccinated multitude of young people in a time when there's a virus that's going even faster. And before anybody thinks twice, we routinely vaccinate our youngsters against mumps, measles, rubella, whooping cough, as we've had since I was a young boy, and they vaccinated us against polio and other serious diseases. So when public health is able to identify an appropriate vaccine for those under the age of 12, then those can be administered. But until that happens, getting back to school becomes problematic. And so the school superintendents that we talked to today, we at least just started out the process of how we're going to work together as the day goes by. When this is over, we're going to have another call with our municipal officials. We had one on Friday to discuss just the issues that are around workforce vaccinations for the government workforces. We'll talk about a broader list of topics with them. But this is how this county administration operates. We operate collegially. We work with the unions. We work with department heads. We listen to people outside of the government. We communicate with our local officials. We communicate with our state officials. We communicate with our school districts. We are not operating in a vacuum, and in none of this is partisanship a droplet of our concern. When we work with the local governments, we don't care one bit what side of the aisle we're on. We're on a single path right now, and that is to deal with a pandemic that's with us now, 17 months deep. This will make it 18 months at the end of this month. And it's a serious issue, and we want to make sure that we can do what we can. As I mentioned, back-to-school vaccination clinics will be in effect for COVID, and we also have provisions for the normal childhood vaccinations that are required in order to go to school. The Society has long since determined that MMR vaccinations are a requirement. So on Mondays and Thursdays from now through the end of August, we will have vaccinations available at our local clinic in in White Plains and in Yonkers. It's Monday, Thursdays in Yonkers and Fridays in White Plains, I believe. It's already underway. It continues. If you have any questions, consult our westchestergov.com website, and they'll give you all the details. But we have the whole month of August. There's still 29 days left on this, the second day. So if you have a child who's scheduled to go back to school, they need to be vaccinated. We will be there to help you do that. If you get vaccinated through your local medical doctor or professional, if you get vaccinated at a neighborhood health clinic, fine. We don't need you to change your strategies. But if you don't have that at fingertip, that's what the county clinics are there for, and we'll be happy to help you with those situations. If you'd like to get information on back-to-school clinics for the back-to-school vaccinations for the young ones, call 995-5800, 995-5800, and that will help you connect into the locations both in Yonkers and in White Plains. And anybody who wants a COVID-19 vaccine can come to either of those two clinics without an appointment, and they can receive their vaccinations. As I get ready to leave the COVID situation, we are continuing to monitor these situations. We are still in a weekly update mode, Monday afternoons at 2 o'clock. During the heart of the pandemic, we communicated this daily, and then we ratcheted it back, depending on the circumstances, to 3 times a week, and then 2, and now to 1. We will communicate more frequently on a regular basis or an irregular basis, depending on issues that arise, if this rise in cases becomes another full-flown spike, and policies have to be made. We will tell you as soon as we make them. Transparency is not only important as a matter of good government public policy, but it's necessary if people are going to be able to respond to masks, to vaccinations. We have to be transparent. We have to talk about these things, and you have to know what we're thinking, and then you make your assessments of where we go from there. I'm going to switch gears now to a couple of the other topics that we wanted to talk about today. The next one is the one that will involve Bridget Gibbons, who is our Director of Economic Development. Bridget has been with us since the beginning of the administration. She has been involved in both small businesses and major corporations in her career. She's done a terrific job for us. She's been very innovative we've discussed this before, Element 46 and Launch 1000. She's been critical in our IDA efforts and how we've been able to incent the growth of Morgan and Regeneron, which brings a huge number of jobs into Westchester County. So there's a lot of good things happening in this area. Today, she's going to talk about a construction career fair that is coming up a little later in this month, and how that will reach out to a number of people. So Bridget Gibbons, Director of Economic Development, please join us. Let's pull it out for Bridget so you can stand.
Oh, goodness. How nice. Thank you, County Executive. I'm happy to announce today that we, at the request of the County Executive, will be conducting a construction career fair to be held on August 25th between 11 and 2 at 123 Main Street in White Plains. This is the New York Power Authority building, which you'll enter from Hamilton Avenue. We're doing this job fair in partnership with the Westchester Putnam Workforce Development Board. Tom Kleiner's the director, and his team, really to help residents of Westchester County learn about careers in construction. And in the construction industry. There are specifically 2 large projects in White Plains, the Mitchell, which is on Mamaroneck and Mitchell Avenue. You may have seen it, it's under construction. And in the future, the Gateway 2 project will be hiring close to 600 construction workers. The general contractor, LRC Construction, and the subcontractors are hiring laborers, carpenters, plumbers, painters, drivers, electricians, sheetrockers, building maintenance, security, and masons. The positions range from entry-level laborers to more skilled positions such as electricians and plumbers. And the career fair is open to Westchester residents, but also residents from the Bronx, Dutchess, Orange, Putnam, and Rockland counties. To pre-register, you can go to rb.gy/VXWLVG. I'll say that again, rb.gy/VXWLVG. Those attending the career fair should bring their resume and be prepared to interview. There will be folks that are doing hiring, so be prepared to interview. If you have any questions about the job fair, you can contact me, Bridget Gibbons, at 914-995-2952, or my email address, which is bgibbons@westchestergov.com. Thank you.
Thank you, Bridget.
You're welcome.
Again, if you'd like to reach Bridget Gibbons, our Director of Economic Development, 995-2900. That's the general number here at our executive floor. And you can connect down through Bridget and any member of her team, and she'll be happy to reinforce some of this information. But this job fair is coming up on the 25th of August for very specific projects here in White Plains. We have tried to shape our policies when we're involved in incentivizing these businesses with certain benefits to try very hard to get a higher percentage of Westchester residents working on these jobs. Obviously, they have to have the requisite experience, and the job fair tries to make that connection between either the individuals, and they could be union, as well with the developers who are looking to hire people to get the work done. So, Bridget, thank you for that, and thank you for all the good work you're doing in economic development. I want to highlight that as much as we've talked about COVID nonstop over the last 17 months, we have not abandoned all of the other responsibilities of county government. You've seen us having a number of these updates or other press conferences where we're out at various parks, where we're talking about the physical improvement, the capital improvement of parks, the investment we're making at the Whiteman Mansion as part of Lenoir Preserve, the investment we're making to fix the lighthouse in Tarrytown and Sleepy Hollow. We've also talked about affordable housing. You saw us with a ribbon cutting for a 34-unit complex in Portchester, and we're very close to a 75-unit complex coming online in Greenburgh. And I had the chance when I was in Peekskill this weekend looking at an 82-unit complex in Peekskill. So there's lots of things we have to do, and in none of these things do we claim ultimate victory. These are all steps in a progression toward a goal. One of the things that we are very proud of is our park system, the 55 parks that we have, and they range across the board. You've seen it if you've followed us at all. If you're familiar with our parks, regardless of whatever we talk about, we've got 6 public golf courses, we've got 6 nature centers, we have an amusement park, we have trails galore that are in the center of the county, in the western part of the county, so I'm going to ask Ken Jenkins to give us an update on some of the more popular recreational facilities that we have, and so to give a weekend or following the weekend report of how well we're doing. Ken.
Thanks, George. And certainly because the county executive's leadership in making sure to point out all of those investments, because it was very important for the people of Westchester County, as the pandemic showed, to get out and play, if I remember the term correctly, from our Parks Department, nationally accredited and certainly well recognized. This weekend at Playland, this weekend was a fantastic weekend. We have had several weekends where things have been rained out, and that was another accomplishment between the numbers between this year and last year. It is so much more people that are enjoying the places in Westchester County. Playland year to date has had 171,000, almost 172,000 people that have visited Playland Amusement Park. Our beaches, last year, our beaches had 9,794 people that visited. This year to date so far, we've had 42,000 people that have been able to go to that. And yeah, certainly there's some combinations. Everyone looks at the numbers. I know you're all looking at home and going, wait, that sounds like that's wrong. It is not. Because of getting back Glen Island, which is the county's largest beach, we have 42,000 people that are taking advantage of that. And now they're going to need to make sure to take advantage of in the public areas, as the county executive pointed out earlier, in those public areas, in those public spaces, concession stands, restrooms, et cetera, to be able to mask up just like they did last year. Our pools, 95,000, almost 100,000 people have taken advantage of Westchester County pools. And once again, we got to say this, we've had some tremendous weather days where we've had flooding and things that have happened, complete rainouts for entire weekends. Holiday weekend, we had a rain out for that particular weekend. Almost 100,000 people, Westchester residents, have taken advantage of that. And golf rounds, we're still ahead of last year's pace, which set a record last year, where you had 145,000 rounds of golf that have been played in Westchester County. Once again, when the county executive pointing out the decisions that he was allowed to make from a statewide perspective and keeping those things open during the pandemic, it was so critically important for people to go out and get out and be able to walk around and take advantage of their parks, their nationally accredited park system. Thanks, George.
Thank you, Ken. I want to make sure we properly credit for these things that Ken has talked about the terrific staff we have in Parks, Recreation, and Conservation. As we've mentioned more than once when we've been out at some of these sites, many times it's the parks of Westchester County that are the most public used facilities in Westchester County. We have household cleanup days that our Department of Environmental Facilities operate every year, but we really don't see the work that they do in handling recycling and garbage and treating sewage. That's really not part of our every night conversation. But we see every day the terrific park system that we have. So I want to tip our hat to Kathy O'Connor, who is the commissioner of that department, Peter Tartaglia, who's the first deputy commissioner of it, senior leaders Andre Early, who is new to the department. We're happy that Andre has joined our team. Neil Squillanti, who's long-term members. In fact, the leadership of this department, as with many other departments in county government, precede our administration and precede the prior administration. And we understood the value of keeping professional people, promoting from within where warranted, and trying to keep a sense that with a different management style and different management techniques, we could get the kind of results that we're seeing, both in terms of number of people, but also the quality of the parks. I hear people all the time go to Playland and remark how much nicer it looks with the improvements that we've made, with many more yet ahead of us. So all of those things are part of our narrative. I'm going to consult with Catherine Chaffee to see if we have some press questions today.
So the first question comes from David Wolf from News 12. He asks if you can comment on the CDC recommending that indoor mask wearing in public happen in counties with substantial or high COVID transmission rates. And Westchester is now on that list. Can you comment on that?
Well, we certainly see the value of mask wearing indoors now. We had hoped we wouldn't have to go back to that standard, but clearly the communicability nature of the virus has required us to do that, and so we have adopted that standard within the county government. As I said earlier, my authority as a county executive is limited at this stage of the game. I cannot create a policy that affects every person in Westchester County, but I can establish a policy. We have, as an executive team, established that policy, and we have to make sure it's implemented. But we do think now that we're at a point where indoor mask wearing is a necessity in order to reduce the spread of the Delta variant. We have a great tool in the vaccinations. That's a tool we didn't have, but we have to remember now to use all the tools. As much as I'm not a big fan of social distancing, I don't like to give an elbow when a handshake is available or a pat on the back, but I would agree that if the CDC has seen the situation, what we've seen in the situation, the Delta variant is growing in impact, and so we have to go back and take measures like indoor mask wearing to combat it.
Okay, we had a little mic issue, so for those at home who didn't hear me, that was a question from News 12. The next question is from David Proper from the Journal News. He asks, how can county workers be persuaded to take the vaccine voluntarily if they've failed to do so after months of ample opportunity?
Well, the opportunity has been there over these months, but not necessarily the dialogue with individuals. We have become a society where we talk past each other rather than talk to each other. And, the rhetoric is you ought to do this. The people who get vaccinated, and I'm one of them, who just say, well, if you're not vaccinated, you're somehow wrong or crazy. People who are unvaccinated have their reasons. Whether I think they're credible reasons or not is irrelevant. They believe that they're important reasons. And the only way to deal with people from a position of honesty, man and woman to man and woman, is to dialogue with them, to talk through what those problems are and see if they can be addressed in an interpersonal way. And I think sometimes, what we're seeing now with social media is the amplification of dialogue that's disembodied. I get on Facebook and my name goes up there, but other than that, I'm just talking at somebody like this and they're talking back at me. You need face-to-face communication with people. You need to have that. I mentioned before my corporate career involved direct sales and the marketing and sales management of people. And you can't just call a client and say, hey, we want you to sign an order for X, Y, Z. It doesn't work that way. You have to develop a relationship with that person. So I think what's different, what will help us, David, is that we have tried over the course of these 3.5 years to have a good working relationship with the workers of this county. We have closed union contracts that were left open when we walked in the door. We did not undo contracts that we inherited that weren't funded properly. We figured out how to fund them properly so we could honor a commitment that was made. When we looked at the impact of COVID, we gave additional time off and benefits to employees to recognize the sacrifices they made during COVID. when we know that we needed individuals to help us run elections. We went out to our workforce and said, would you consider, we didn't mandate anything, would you consider taking discretionary time to be an election inspector, and we'll give you a benefit to do that. In every one of those interactions, we did something different than perhaps some of the other governments did. Some governments say, I order you to do this. We don't see it that way. If this crisis goes back up to 12,000 people 12,000 people with active cases, 1,200 hospitalized, then we will ramp up our response. And at some point in time, we might be in a situation with emergency powers granted in some horrific future that I hope never happens, where we'll have to do certain things. And if those things happen, it'll happen when the governor and the president does it. They won't wait for the county executive to do it. But I think respect for an individual. Person says, I have personal rights. You do. Let's dialogue as individuals. Let's talk as intelligent people. I spent my life trying to convince you that my product or service is worthwhile. I spent some time convincing you that I would be the right person to elect to public office. So clearly my default mode is not to tell you to do something, but to help you see the value of doing something because it's important for you to do it, and that you would begin to do it. Will we get everybody? No, we won't get everybody. Will we make progress? I think we will. And I think that's the difference between the philosophy of what we're doing versus when you see, well, somebody's mandated this, somebody else has mandated this, we're going to mandate this. Let's see what we can do this way. I think this is the smarter way. And I might add, there's an article in the Washington Post today which they talked about the counterproductive nature of mandates. And why did that resonate with me? Because I remember as a boy growing up how resentful I was when I was told to do something. You know, I did it because I was afraid if I didn't do it, but I did it reluctantly and begrudgingly. And I didn't really understand why I was being able to do it. And now I understand. If you can help me understand, maybe I can get to that point where I'll do it because I want to do it. That's what we're striving for.
And the next question, which is also the last question, comes from Samantha Crawford from News 12 Westchester. She asks, are there any routes that would permit you as the county executive to institute a mask mandate everywhere in the county, including private businesses?
No, not at this stage of the game. I don't have that authority as county executive. There were certain emergency powers that were granted to the governor by the state legislature last year that did give the governor overarching power to do things like that. I don't know if the action that's been taken by the state legislature to retract some of those emergency powers have taken those particular powers away. But as a county executive, I do not have the ability to mandate every man, woman, and child in Westchester County must wear a mask. I encourage it, and we are making it happen in those areas where I do have direct control, which is where we have county facilities and county operations. And when you look at the sequence of events, making somebody vaccinate if they have certainly a health issue or a defined religious opposition to it is a very difficult thing to do. But asking somebody to wear a mask is a behavioral action that is easier to do. You put the mask on in 2 seconds. You're not waiting to be vaccinated and then revaccinated. So I think a mask mandate is a reasonable thing to mandate. And I think with vaccinations, I draw that differentiation in my mind. People have a stronger opposition to it. And that is where you're required, I think, to have the dialogue that I've just referred to. Any other questions? Okay. Right. We thank you for tuning in. I want to thank again Deputy Commissioner Terrence Rayner, who is with us today. I want to thank Bridget Gibbons, who is with us today. Of course, Ken Jenkins. We're always together in these things. And I want to thank the people of Westchester County, for those who watch either in real time or watch it on tape, or maybe you'll watch some sort of a clip off of all of these things. These reports are getting a little bit longer now because we're into an area where we have some issues, and we do want to use this as an opportunity to explain some of the other policies and other things that are happening. We do not have a formal report scheduled for the rest of the week. We will have a press conference, as I mentioned, about the issues that relate to our our residential real estate setting, which I think we all realize is going, selling like hotcakes right now in all communities of the county. And that does reflect part of the narrative. Are people leaving Westchester, or are some people leaving and other people coming in because they've reached a time in their life where it's the right time to be in Westchester, and for other people it's the right time for them to be someplace else? We'll have that discussion in the days ahead. I do want to make just a final closing comment, which is along the lines of what I've said already. We have to decide as a nation who we are. What do we believe in? It's always a test. And as I mentioned to Ken sort of offhandedly, we've had these debates in high school, we've had these debates in college. And it's a debate that happens because we are a free nation. When someone says, do you love America? Yes, I love America, because it gives us this opportunity to have freedom. But that freedom requires us also to be good citizens and to think of the nation as a whole and not just you, the individual. And that's a tough line to make, because we all care about ourselves and our immediate family first and foremost. And, if we don't, who else will? But it's important for us to understand, this is, I've said this before, this is our test. This is, who are we? Who are we made up of? Do we have the diligence? Do we have the perseverance? Do we have the discipline? I've joked, my friends all know that I'm on a no-carbs diet. This is my 16th day. I'm counting the days. There isn't a person in my world that doesn't know how many days, because I tell it to everybody. I'm getting a little bit of progress. I'm not there yet. And I'm testing myself. Can I get back into some better physical shape? How many of you out there are in the same boat that I'm in, that you have a weight problem and you have to deal with it, and it's hard to make the movement? I'm trying right now, and we'll see if I can stick to it. And I hope if you're trying that you can stick to it, because we're all, at the end of the day, we're not people with titles, we're human beings. We're trying to live on this planet in peace for the amount of time that we have on this planet. And right now we face a crisis, we face it together. And I honestly, truly believe we can get through this crisis if we think of it as something that we're in together. Not something that I'm here and you're there, and I believe this and you believe that, and I'm of this demographic and you're of that demographic, I'm of this party or that party. That at the end of the day, we are all Americans, and we are all humans on the same planet. I think we can get through this. I believe we can, and we will. If you believe the same thing, then we'll find that place we get to where we can do this together. I'm George Latimer, Westchester County Executive. Thank you for watching, and we'll see you again a week from today at 2 o'clock, and we'll be in dialogue in the meantime. Have a good day, and stay safe, and wear your mask.